Lipedema is a frequently misunderstood and alarmingly underdiagnosed issue. Let's take the name just on its own. It is pronounced lipedema, lipodema. It's also spelt differently in different countries. It can be spelt lipoedema or lipedema. Unfortunately, it sounds very similar to lymphedema, which is probably why many doctors actually call it lipedema, just so you can have that distinction between lipedema sounding like lymphedema. And I know for myself, often I have said to people, oh, I have lipedema. And they go, oh, yeah. And I say, no, not lymphedema. And then they look at you because that's exactly what they think that you've got. So even the name is tricky. The disease is tricky. But just so you know, you can pronounce it lipedema or lipedema. I pronounce it lipedema because that's how I learned it, so it kind of sticks. But that's what I'm talking about, lipedema and lipedema today. Lipedema is a connective tissue disorder, and more importantly, it is a chronic inflammatory disease. This is key. It both causes inflammation and is made worse by inflammation. It's this loop that we struggle to get out of. It is characterized by abnormal fat deposition on the body. So this is the women with the tiny tops and the big backsides. This is the women that have slim forearms but excessively large upper arms. And I say women, however, it is potentially mostly a female disease, and this is what it's been reported as up until recently, but there are men with high estrogen levels, that's the key, that have got lipedema. They're just not as diagnosed, much like the women, and probably their issues don't get really evident until they're really overweight anyway. So that whole obesity and lipedema thing that people don't know the difference between is probably more obvious or more playing out with men than women, which is why up until recently we thought it was a woman-only disease. It occurs in up to 18% of women. The most common statistic out there is 11% of women, but now they're starting to understand it's probably between 11 and 18% of women now, which is a huge ratio of women if you keep in mind that diabetes is 9% of people. So 11 to 18% of women with lipedema is massive. Now, the key distinctions of lipedema: with obesity, fat isn't painful. If you get knocked, pushed up against a wall, blood pressure taken, that kind of thing is not painful. In lipedema, it's excruciating. So that's a key differentiation to understand that you have lipedema and that you're not just overweight. The fat deposition on your body is almost always from sort of the waist down to the ankles. There's cuffing at the ankles. There's fat pads at the fronts of the knees, at the backs of the knees, and it's symmetrical, right? So it's on both sides of the body, as opposed to lymphedema that usually occurs in one limb or one side of the body, because that's where the lymph node has either been removed or damaged in some way. The classic visuals that you will see if you walk through the shops and you look at other girls, particularly our new generation of girls that are wearing the shorty shorts because they have got a much better body positivity feeling about themselves than we had at my age now. And so you can see it. Wearing the short shorts, even though they've got the thick thighs, is like amazing to me because I can look at it and go, look at that. That is lipedema. And it's becoming more common. But the visual keys is that cuffing at the ankles, like you're wearing tight socks, and then there's the little fat spillover, or like a rubber band around your ankles, and generally at the elbows as well if the arm lipedema is at play. That's about 30% of women with lipedema have the upper arm type as well, so that may not be at play. But also the legs are very column-like. There's kind of no shape to them. Whereas if you look at a woman who is obese as opposed to someone with lipedema, there's generally still shape to the leg. Okay, you can have lipedema and obesity together, but these are the distinctions that kind of pull them apart. So what causes lipedema? So the research that's been done so far shows that lipedema is caused by lymphatics that don't work very well from birth. So you're born with this, it's a genetic issue. What happens with the lymphatics is it's kind of like they're leaky, like you get leaky gut syndrome. When the fluid in the lymphatics seeps through the lymphatic vessels, it goes into the subcutaneous tissues. And once it's there, it becomes fibrotic because inflammation causes the body to sort of put a little cage around it that's made of connective tissue, so collagen, and it makes it really hard and rough. And that's part of the reason that you get the pain, is because when you press against it and it's just under your skin where it shouldn't be, it hurts because of this fibrosis caused by the inflammation causing the pain. It also means that because it's been put in this little cage in a place out of reach, that's why diet and exercise don't touch lipedema from a perspective of losing that fat. Biopsies that they've done so far show a thicker layer of collagen around the fat cells than should normally be there. So it's like a brick wall, keeping things safe, keeping things away from everything else, which isn't ideal. There is a hormonal trigger here, and that is the estrogen, as I've already mentioned. Estrogen can cause progressive lipedema, which is why it mostly shows itself, because remember, we're born with these leaky lymphatic issue, but it mostly shows itself at high hormonal times. So puberty, pregnancy, and menopause. And any other time. So like in my case, when I was 21, my thyroid tanked. So that was a couple of years of really rocky hormonal issues in my body. That was when my lipedema exploded. I thought it was weight that came on from the thyroid. It was not. It was from the lipedema, and I was never able to lose it again after that. So high hormonal times, diabetes, sugar issues, they are hormones. So higher hormonal times will influence your lipedema. Even once you have it, estrogens are thought to stimulate the fibroblasts to be out of control. And they're the things that put the coating around the lipedema fat balls, right? So making them hard and fibrotic. And that sort of gets out of control. So estrogen directly influences that, from what they understand from studies at this point in time. Diagnosis, stages, and types. Now, if you're lucky enough to live in an area where you know you can find a doctor that can diagnose your stage and type of lipedema, amazing. It kind of doesn't do much for you apart from awareness, which is important, because unless you can afford to have the surgery to have it removed, there's not a lot more that you can do. And I say that because generally most of us can self-diagnose from all of this information, from all of the visuals and the pictures and the people that are sharing their stories. We can kind of guess that, oh, look at that, I've got stage 2, type 3 and 4. Yeah, right, okay, these are my options from conventional therapies perspective. But if you can find a doctor, then he or she is more likely to go into the comorbidities that come along with lipedema and make sure as a whole you're getting what you need to get for therapy and a quality of life that is better. From a diagnosis perspective, there is no blood tests, biomarkers, imaging, resonance machines, or anything like that that can actually definitively diagnose lipedema, which is kind of sad. It's based on questionnaires, seeing your symptoms, it's putting together, in fact, it's kind of like a syndrome almost. So syndromes are a collection of symptoms that they go, oh, this kind of equals this. So that's where we're at the moment with lipedema. It's collecting all the symptomology, the look of your body, the stages, the types, that kind of thing, for them to say, yep, I'd say you've got lipedema, stage this, type that. You might have the fat nodules on your knees, the fat pads on the backs of your knees. You can feel the rice-like texture of the balls of fat, because fat in lipedema is round and hard. So you can feel it. It might be as big as peas or walnuts under your skin, but generally you can feel them when you palpate them. So that's part of diagnosis. There's the cuffing at the ankles and potentially the elbows or even the wrists if you've got full arms, which is really rare. That is another way of diagnosis because that doesn't happen in normal obesity, doesn't happen in lymphedema. In lymphedema, the cuffing at the ankles, it continues on to the feet. So the stages of lipedema: stage 1, you're looking at smooth skin, disproportionate fat is visible. You may feel the little peas or grains of rice under the skin, you may not. In stage 2, the skin becomes more dimpled, it shows a mattress kind of pattern or a cellulite pattern, and this is where most people would sort of just assume they have a severe case of cellulite, but the nodules are more obvious and probably the pain has definitely increased in this stage. Stage 3 is really severe fat deposition. The legs are definitely straight up and down, fat lobules are getting larger, the tissue feels really firm and fibrotic, so that pain is at play. Then you can get to a stage 4, which is actually when the lipedema becomes lipolymphedema. And lymphedema has become combined with the lipedema and resulting in swelling and pitting edema, and it involves the feet and the ankles. And this progression to this stage generally only occurs if conservative treatment has been neglected and ignored. So you can stop yourself progressing along the stages, but you have to put in the work. You've got to do the things that you need to do to stop the progression. Now we look at the types, and this is what distinguishes each stage from the other. So you can have 2 people that are stage 2, but one person might have type 1 and 3, and another person might have type 3 and 4. So this is what helps to classify your body for you moving forward. It may not be helpful for whatever reason, but this is all they've got. They've got no other tests to classify your particular version of lipedema, so this is what they use. So let's look at the types. Type 1 is hips and buttocks. So the backside and the hips only is all that's affected. This is kind of the jodhpur look, the riding breeches look. It's just in that place. And this person probably has the small upper trunk and has got quite shapely calves and knees. And the fat doesn't actually start to sort of look strange until you get to mid-thighs to the hip area. Type 2 is the hips down to the knees. It is a little bit more obvious around the knees. You're starting to get an overhang of fat. It's starting to look like, it's almost like cuffing at the knees instead of cuffing at the ankles with this type. Type 3 is the waist down to the ankles, and it's kind of the harem pants look. You've just got these big columns that kind of stay the same shape and size all the way down to the ankles, and you've got quite severe cuffing around the ankles because of that. Type 4 is specific to the arms. 30% of women with lipedema will get it in the upper arms. I got it in the upper arms, so that was a type for me and would continue to be a type for me if I don't keep the inflammation at bay and the hormones low. Type 5 is quite rare and it's around the calves. It's actually quite painful, but it is quite unusual to only have it in the calf muscles and nowhere else on the body. So this is knee to ankle. You'll probably see the cuffing in this case around the ankle, but that is the primary. If you've got lower legs that look remarkably different to everything else in the body, you've got type 5 of lipedema. Let's look closer at why lipedema hurts so much, why it is also called painful fat syndrome. And this comes down to the fibrosis of the tissue around the fat. So this is collagen, connective tissue that is out of control due to fibroblasts that are out of control. And you don't need to understand what fibroblasts are or anything like that, but something's out of control and it's causing this hard, rigid wall around the balls of fat that has seeped through your leaky lymphatics. These hard balls, they compress nerves, so that causes pain. And they can also compress blood vessels, so it can cut off circulation in your arms. You can get pins and needles a lot, things like that. But this mechanical issues, so the pressing down of things, sends pain signals to the brain, because it hurts. The second thing that causes the pain is the fluid retention that is caused, and then the inflammation that comes about as part of that fluid retention. When the fluid can't drain away, which often happens in the case of lipedema, it gets trapped and cannot drain. That causes pain and swelling and increased tension under the skin. This results in chronic inflammation. So chronic is anything that happens for longer than 3 months. And if you're born with this and it has started, so it has shown itself, then it's potential that it is progressing and it's considered chronic, because you're going to be dealing with this for the rest of your life, or until they find some kind of way of reversing it. You never know, right? So chronic inflammation releases chemicals that not only cause pain, but cause a sensitivity, a hypersensitivity to pain. So the pain in lipedema women is often higher on the scale than somebody without it. So somebody with a pain level of 2 or 3 out of 10, potentially the same person with the same pain with lipedema could be more like a 6 or an 8 out of 10. So that hypersensitivity to pain and not coping with pain is higher in women with lipedema. So inflammation is kind of like a volume knob that turns up the pain levels, making every sensation feel worse. Let's talk about associated conditions and complexities around lipedema. Inflammation is first and foremost, the inflammation connection. There are many comorbidities linked to inflammation and therefore linked to lipedema, which is a multi-organ issue. So anything that you have separate to lipedema that is an inflammatory issue is going to have a knock-on effect with making lipedema worse. I myself have Hashimoto's thyroiditis, have had it since I was 21. That is also an inflammatory disease, which is made worse by inflammation and makes inflammation in its own right. Things like arthritis, leaky gut syndrome, and even obesity causes low-grade inflammation in the body, which then can easily become a comorbidity of lipedema. Connective tissue disorders are also quite common with lipedema because of the ligament laxicity. I don't know if that's a word, but the laxness, the knots, tightness of the ligaments at play. This is hypermobile joints. This is Ehlers-Danlos syndrome. This is mast cell activation syndrome. This is POTS. These are all issues to do with connective tissue and systemic syndromes that can be connected to lipedema. Then we need to look at the psychological impact of lipedema as comorbidities, because they exist and they're very real. In fact, I found a study recently that said 8% of women with lipedema have attempted suicide in their lifetimes due to the sheer traumatic effect of lipedema on our emotions, on our body, on our life, on our relationships, on everything. This is a struggle of a disease. It causes pain. It makes us question our worth, our ability to make good decisions for ourselves. It affects so much. We are subject to opinions and judgments from so many other people, and we think we're doing things wrong all the time. Otherwise, we would have been able to fix it, right? Mental health, anxiety, depression, suicidal tendencies, they all come along with lipedema if we're not taking care of ourselves. Treatment and pain strategies. What do we do? That's the main thing, right? We know we've got it. We potentially know we've got what stage and type. We know what our symptoms are for us personally. What do we do? The first thing we're going to look at is inflammation, and you've got to start an anti-inflammatory diet of some kind. If you're up here on eating out every meal, having processed foods, or you live on takeaway, because that's what your family has always done. There's no shade on you for that. You just always do what you've always done within your family environment, okay? There's nobody to blame for that. But now you have to take responsibility and say to yourself, if I want to reverse this, then I have to find an anti-inflammatory diet. And you may not even know what that is because you've never been taught. So don't put that on your head as why shouldn't I? Why haven't I known this? Because that's not your fault. It is what it is. We just now learn better and therefore do better. So the first step in any kind of treatment would be an anti-inflammatory diet. And the very basics for that would be to remove all processed foods, remove all junk foods, remove seed oils. That's a key indicator there. And potentially remove anything from your diet that you are intolerant to. But that generally requires testing to see what your intolerances are. And intolerances and allergies, well, not so much allergies, but intolerances can change every 6 months. So that's tricky to keep up on. If you want to go a step further, you can look at a keto diet or a carnivore diet. Let's start with the keto diet. You're removing things from your life like grains that can be toxic to the lymphatics and carbs. And that is also putting you very much into ketogenic status, which what happens is your body swaps from sugar burning to fat burning. And when it swaps to fat burning, it releases ketones. Ketones are anti-inflammatory. You have to figure out for you what your level of carbs that you can eat per day to be in ketosis, to be able to have that effect on your body. Everybody is different. I have a, blood test glucose thingy that also tests for ketones. And I know for me, I have to be a strict carnivore to be able to get myself into ketosis long term. So I can't have any kind of carbs. You have to find out what that is for you. But certainly the beginning is to cut out the processed foods, the seed oils, fructose. Fructose is a big driver of lipedema and a big problem in the body, causing inflammation. So anything that has fructose in it is going to cause an issue. Now, some vegetables and fruits are high in fructose, and there are some vegetables and fruits that are low in fructose. So if you're following a ketogenic diet and not making any headway, then I'd look at not just having fruit and veg as a whole, but look at having the low fructose versions of those fruits and veg and see if that makes any difference for you. After the anti-inflammatory diet, the next thing on our list for interventions here is movement. We need to move. We need to move our lymphatics. Our lymphatics are like butter. If they're cold and stagnant, they're like cold butter out of the fridge. If they're warm and flowing like they're meant to be, they're like melted butter that can move through our body. It does not have its own pump system, remember. The lymphatics is like the blood in the way it moves around the body. However, the blood has the heart to pump it. The lymphatics does not, although the calf muscles have been called the second heart. If you looked at the challenge video I did on calf raises, the calf raise would be a way of moving the lymphatics and pumping it, because it's not until we move and we go up and down that the one-way valves in the lymphatic vessels open to allow the melted butter, the soft, liquid, free-flowing lymphatic fluid that we should have through up until the next section and eventually out into the bloodstream where it can be dispelled. So low impact, whatever you can do, whatever you can keep up in the pool, amazing. If you can go to a heated pool, if that's more comfortable to you, but anything that you can do ongoing that's low impact, even just walking, lean over a trolley, go to the biggest supermarket, shopping mall that you have available to you. Hopefully it's indoors and has heating or air conditioning if you're in extreme climates. Hang over that trolley and walk and walk and walk for as long as you can. That is low impact, and that will move your lymphatics and keep it flowing and liquid. Manual lymphatic drainage massage is another way of improving the lymphatic flow and reducing swelling and reducing fluid that's being caught. And wearing compressions daily may help with both the pain levels and with keeping fluid from pooling where it shouldn't be, which causes the inflammation and the pain. Then you can look at more targeted things like pneumatic pumps, which are like big legs that you put on top of your legs and they blow up. If anyone's ever been in a surgery in the last, I'm going to say 10 years, often they bring a pump around to pump your legs when you're not moving. And it's the same sort of thing. You can get these machines to have at home. They're quite pricey. You can rent them in a lot of cases. Just make sure you're dealing with somebody who understands lipedema when you rent or purchase one of these. But I've seen or read that they're quite helpful for pain, swelling, and inflammation of the legs, and to get the venous return back and to get the lymphatics flowing the way they should. There is also vibration therapy, so standing on a vibration plate is really helpful for breaking down the fibrotic tissue. It also increases muscle strength, and our muscles generally aren't as good as they could be because we don't want to exercise. We don't want to because we've got sore ligaments, and every time you go to the gym, even now that I've lost half my body weight and I am trying to build muscle, I go to the gym, and if I do weights and that sort of thing, I have to be super careful because I know the ligaments in my shoulders are not strong. They're not tight and fling back the way they should do. And that particularly happens after menopause as well. So if you're in that age group, be super careful about what you're doing. But the vibration plate can increase muscle strength, which is very helpful. And it moves all the fluid around as well. So there's different kinds. There's the flat ones. You can get the big ones where you actually hold on. So just pick the one that's right for you and in your price range, but that has been shown to be really helpful. Lastly, in the treatment and pain management sector, we've got liposuction. There are a lot of lipedema specialists out there now that do this, and they do lymph sparing liposuction. They don't have to be classed as a lipedema surgeon to be able to do this. The surgeon that did my arms, she was more about reconstruction for women that have gone through burns and things like that. But she knew everything there was to know about the lymphatic net. And she even explained to me in the surgical rooms beforehand, like, no, we have to be careful. We have to lift up the net and get underneath it. And she gave me videos and photos of doing just that after the surgery. So don't feel like you have to go to a lipedema surgeon that markets themselves as lipedema. Just make sure that your surgeon knows this kind of talk. They talk about the lymphatic net. They talk about how they spare it. They talk about what kind of liposuction they do, that kind of thing, all right? So don't be hemmed into, I've got to go to a lipedema marketed surgeon, because that's not always the case. There's some very good surgeons out there that know exactly what they're doing when it comes to lipedema. Keep in mind, liposuction, while it might sound like the cure for lipedema, it is not. Because often we were not born into stage 2 lipedema, right? We were born with leaky lymphatic vessels. And it's not until hormones get out of control and inflammation becomes a thing that we then grow the lipedema fat. So if after having your surgery on your arms and they're nice and lovely and slim and beautiful, and you never thought, like I never thought, I would have arms that looked like this in my life, if I don't follow an anti-inflammatory diet and if I don't keep my hormones stable, they will come back, because stage 4 in the arms is something that I have. That is my weakness in my lymphatics. Okay, that's why we like to know the classification, because if you go to the trouble of spending all the money on these kinds of surgeries, this was 25,000 Australian dollars to just have my upper arms done. So if you're going to do that, you don't want it coming back. It's really important to know that liposuction is a tool to help you get on top of it. It is not the cure, because it's your lymphatics that are leaky that are the problem. Okay, you cannot cure that. Let's look at the final key to this puzzle, and that is the mind and the emotions. If we don't look at this section, you haven't looked at lipedema as a whole. From a mind perspective, let's talk about mistakes and priorities, because we all like to beat ourselves up when we haven't done something. A diagnosis at least gives you a valid explanation for why you are at the space you're in now. It explained for me why for 20 odd years I could not lose weight no matter what I did. Even exercise did nothing, and taking a year off to go to the gym every day, that losing weight was my job. It did nothing. In fact, I put on 2 kilos. Heartbreaking, but you feel me. From a mental perspective, at least you know this is the problem, this is what I'm working with. But you still have to treat this from a mind, body, and emotion perspective. Otherwise, you're not going to get anywhere. I promise you. You may get somewhere physically by doing the physical things, but if your mind and your emotions aren't switched on, You will get bored with doing those daily conservative treatments. You will get bored with wearing your compressions. It will be too hard to eat an anti-inflammatory diet and all those sorts of things, and you will lapse. That's why the mind and the emotions are a key part of lipedema healing that nobody talks about. But we all talk about how we feel neglected and we feel overwhelmed and we feel like we've been forgotten. But yet we don't want to deal with the feelings when it comes to, I want to feel like I can be motivated enough to do these things every day. You, as a lipedema patient, you are your best advocate. You have to know more about your body and what it's going through than anybody else on the planet. More than surgeons, more than doctors, more than researchers, it doesn't matter. Even more than your next door neighbor that also has lipedema but might have a higher stage than you. Because their body's not your body. Your body's not my body. We have to know our own body. We have to start at the beginning. What stage and type are we? What comorbidities do we have? What is potentially activating the inflammation that's more than just the lipedema or the fluid swelling or the tightness of the skin? You have to be prepared to print off a list like I've got down below and take it to your doctor. And if that doctor won't listen or dismisses the idea of lipedema, take it to another doctor. It's up to you to advocate for yourself, and it's up to you to feel strong and in control and empowered around what your options are. But you also need to be kind to yourself, because unless you're working on the emotions and the mental side, you are going to trip up. You are not going to follow a strict diet because we're human, right? 2 months ago, I moved to Bangkok, the land of the seed oil, the land of the roti, the land of delicious food that's all cooked in oils. Have I had some? Oh my God, of course I have. But I can see the difference in my legs, even though my weight hasn't changed. I have to get to a point in my humanness where I don't feel like I need to have those choices and that I can choose something that's more appropriate, or I cook at home more, even though it's more expensive in Bangkok to cook at home than it is to cook out. And many of you out there, I know in America, from what I understand, I've never been, tell me if I'm wrong, it's cheaper to go to the takeaway outlets and buy dinner for the family than it is to cook at home. And that's the case here. It's actually cheaper to eat out. But eating out, you are getting all the seed oils, all the inflammatory items, the numbers, the sugars, the fructose. And that's where we've got to be strong enough emotionally to go, you know what? I actually deserve to spend more on groceries and take the time to cook for myself so that I can feel better and so that I can have no progression of lipedema moving forward, and that I can kind of stay where I'm at. Because once you get to a point where you're staying where you're at, if you do have liposuction and you can afford that journey, then it won't progress again afterwards. And I have seen many, many videos where women complain that, oh, it just came straight back. He must have been a bad surgeon. No, that person did not change the inflammation. That person did not change the hormone balance in their body and went straight back to doing whatever they were doing. Accountability. If you don't have the emotional intelligence, and this takes work, none of us are born with emotional intelligence. We have to kind of work on our feelings and the judgments of others and that kind of thing, so that we can take all the information that we've learned today in this video and put it into practice. And when you trip and you fall, that's okay. You do more emotional work and you start again and you keep going. That's what's going to help you with your end result. All the surgeons, all the diets, all the therapies and conservative treatments in the world is not going to help you if you're not emotionally resilient and strong enough, A, to forgive yourself when you don't do the right thing or choose not to do the right thing. There is a difference. There is a thing called soul food. Going out and exploring Bangkok once a week like we do and having a dumpling or having coconut ice cream or something that's part of this world here, that's soul food. So you have to kind of let yourself emotionally go, that's okay. Once a week, I can enjoy that I live in Bangkok now and this is amazing and I can have these foods or whatever it is for you. Okay, so you've got to be emotionally resilient enough to then the next day back into your normal low carb, no grains, no sugar, no fructose kind of lifestyle if that's working for you. So I hope this video has shown you what stage and type that you have, what treatments are open to you, and that you need to do the emotional work for it all to come into some kind of plan moving forward for the health of your lipedema and for it to not progress out of control and for you to have a pain-free life and to smile every day.